Welcome back to The Daily Dish. How are you feeling right now? Maybe tired? You had energy yesterday, now you're sluggish, you just can't explain your symptoms. Dr. Andrew Petersen is here. He's from the Holtorf Medical Group. And you might have something called Hashimoto's. What is that, Dr. Petersen?
Well, Hashimoto's is the most common cause of hypothyroidism, but it's not exactly the same thing as hypothyroidism. Hypothyroidism means low thyroid hormone. That, of course, causes us to be tired, problems with digestion, constipation, hair gets thin, your skin gets dry, those things. Hashimoto's is an autoimmune disease that causes your thyroid to initially release more thyroid hormone and then not release any. Autoimmune diseases, people have probably heard of those, things like lupus, rheumatoid arthritis, type 1 diabetes. Those are significant problems. Hashimoto's is an autoimmune disease of this gland in your neck, the thyroid.
How many people are affected by this nowadays? I mean, it seems like it's a lot more now than it used to be.
You hear about it.
Mm-hmm.
Yeah, I'm not sure if we just hear about it more or if it's more common. I think it's probably more common.
Do you develop it, and are you more at risk at a certain age? Is
Yes.
it genetic?
Yeah, great question. It is genetic. If that's in your family, you are much more at risk. It's much more common in women, 7 to 1, women to men.
Why is that?
Partly it's due to pregnancy.
Okay.
It also probably has some role with regard to women's immune systems and men's immune systems. There are infectious diseases that cause Hashimoto's, viruses in particular. There's a virus called HHV6. It causes roseola when we're little kids. Well, if that virus sticks around in our body, it can cause that autoimmune disease. Cytomegalovirus, it's another virus we get when we're kids, and then Lyme disease.
How are you diagnosed with Hashimoto's? What is the process?
Well, what happens most of the time when people have these symptoms, they go to their doctor and they say, I feel tired or my hair's getting thin, and the doctor does a TSH. And if that's the only test he does.
What's a TSH?
A TSH is what's called thyroid stimulating hormone.
Okay.
That's a hormone made by the brain, by the pituitary. And the problem is, what it tells you is the pituitary talking to the thyroid gland? And so most of the time, Hashimoto's thyroiditis is missed because your TSH will still be normal and you haven't looked for the antibodies that are attacking the thyroid. So people will go years having symptoms, feeling bad, then feeling okay, and it's never been diagnosed. The real problem is if they were treated, if it was caught and they were treated, they could prevent having low thyroid.
So once you do start treatment, what does that consist of?
Okay, treatment for low thyroid is to give you thyroid hormone, whether you give T4 or T3. T4 is Synthroid, and that's what most people are on. T3 is called Cytomel. Both of those can work. Depending on the patient, one might work better than the other, and so that's an important thing to test for as well. But then there are things that can reduce the inflammation and the antibodies. Naltrexone is a great medicine for that, treating their hormones. Adrenal fatigue or Addison's disease is also an autoimmune disease. So if a patient has low progesterone, low DHEA, low testosterone, and that's treated, then you can eliminate a lot of those antibodies and they won't have as low thyroid.
I love that you're here because so many of the things you're saying and the terms you're using, I've not heard of before. And I think people sitting out there with symptoms going, wait a minute, I need someone to explain that to me. How it all works and how it all comes together and makes you see you just don't feel good and you don't know why.
Yeah, that's the troubling part with being on television is I use these doctor words and I think, oh no, I just lost them. I think if you can sit down with someone that can listen to your symptoms and then say, these are the tests and this is why, and explain it to you. Honestly, if I can't explain to you why I'm doing the test, I probably shouldn't be doing it. I don't know well enough.
Quickly, I want to touch on this. If you're not treated, if you do have Hashimoto's and you're not treated, what are some symptoms that you'll have for the rest of your life? I mean, what complications could it cause?
Well, for many years, you may simply have periods of fatigue followed by periods of, oh, I feel okay, I must have just been overworked. You can have, your hair will get thin, your skin will get dry, and then that could get better. But the real risk is then you're going to develop low thyroid that will be there the rest of your life because those antibodies that are attacking the gland, if they completely destroy the gland, now you have low thyroid from then on. And so you can prevent that. Low thyroid is a real problem. If you have low thyroid, you're at a greater risk for heart disease. And that's what kills most of us. So if we treat it, it's funny because there's most things we're worried about prevention. We try to prevent heart disease, we try to prevent cancer, we try to prevent diabetes, and yet so many physicians say, oh, it's Hashimoto's, but it's not low thyroid yet, let's don't treat it. But if we treat it, we're going to prevent that problem. And by preventing that problem, we'll prevent heart disease.
And that's what makes everyone out there feel good, is it's not a devastating, doesn't have to be a devastating diagnosis.
Right.
It can be treated.
Exactly. If you're watching wondering, I might have this, I want to talk to Dr. Petersen, you can go to our website and we will be sure to link you, abc4/Daily Dish, and you can find all of Andrew Petersen's, all of his info right there. Thank you so much for joining us.
Thanks for joining us.
Thank you, guys.
We'll be right back with more Dish.